So how do you know when something is wrong with your baby? There are some important things to know, especially in that newborn period, to just know if baby is safe. And so one of the biggest things to watch for in a baby is a fever. You do not need to check your baby's temperature all of the time. It isn't something that you have to continue to do. But if your baby does seem very warm to you, that is a time that we would recommend going ahead and checking their temperature. If you do have to check baby's temperature, the best way to check it and most accurate is with a rectal temperature. The temperatures that check their forehead or under their arms just aren't accurate in babies. There used to be a kind of general rule that, if you check under their arm, you add a degree or certain things like that, but that's actually thought to not be accurate now. And the best way is just to check a rectal temperature in baby. So most of the time the hospital will send you home with a thermometer, and so you have it at home if you do need to use it. And if you felt like your baby was warm or they were just acting strange to you, they weren't wanting to feed, they weren't responding well to you, we would want you to check that temperature, and you would just barely place that thermometer in their bottom to make sure that their temperature isn't high. So fever in a baby is 100.4 Fahrenheit or greater than that. So that is a temperature that we would look out for. In babies, this can be a sign of a serious infection, so it would be something that we would want you to just monitor for. And if it was high, we would recommend you taking them to a pediatric ER if possible, just for best care for baby, just to make sure that they don't have an infection or anything else going on.